The topic that I'm about to discuss today could save your lives, could save the lives of your family and your friends. So listen carefully. What is coronavirus? Coronavirus is a large family of viruses. Example of these viruses are the SARS virus that was discovered during an outbreak in 2003, and also the MERS, the Middle Eastern Virus Syndrome, that was discovered an outbreak during 2014 from the camel, and in late December 2019, a new coronavirus was discovered in Wuhan, China. The virus has a spike that looks like a crown, and that's why it's called coronavirus. And now it's called the newly found virus is known as COVID-19. So how the virus enters into the cell, it can enter through droplets if someone is sneezing or coughing. If someone is sneezing and the contaminated surface contains the virus, you can be also infected by touching the surface and touching your hands. It can also be infected if you eat some contaminated food through oral fecal route. How the virus enters into your lungs. So let us discuss this further at a cellular level. Assuming this is the virus and this is the cells, mucosal cells or your respiratory cells. Now the virus has a spike glycoprotein receptor binding domain containing containing an amino acid residue called glutamine 493 and also asparagine 501 residue. These two amino acids added the polarity of the virus. It added the polarity, thereby the binding of these protein are more favorable to the binding of ACE2 or angiotensin converting enzyme 2. That's why COVID-19 is more contagious. The transmissibility of this virus is way more faster than the other coronaviruses. So we now know that the glycoprotein, the spike glycoprotein will bind to ACE2 receptor. But what happened during the binding, the initial binding, there is a digestion process. A trypsin enzyme is involved, but the trypsin needed an acid to complete the task of digestion. So this cell membrane here will be digested by a trypsin enzyme, then the virus can get inside. So the endosomal enzymes and the lysosomal enzymes will be released, helping the digestion process at an acid pH during the early release of endosomal enzymes at a pH around 6.0 to 6.5, starts the digestion process, but it is not enough. The acidity of the enzyme is not enough to invaginate and fuse in together inside the cell. Is not enough. A second release called late endosomal with a pH of 4.5 to 5.5, causing a complete digestion process with the trypsin enzyme. So the virus can get inside the cell and take over the machinery and replicate the RNA, and then exocytose, get outside, and the cell will undergo apoptosis or cell death, and then infecting another cell. So the viral endocytosis stages, there's a first stage of digestion. So trypsin enzyme is involved. Now, why Asians are less why Asians are less, case fatality rate? The Chinese have 1.1 case fatality rate. The people from Hong Kong has zero point 0.7 case fatality rate. The Japanese have 2.0 case fatality rate, but the Italian have 2.5 case fatality rate. The Iranian have close to 5% fatality rate. The Americans have more than 5% case fatality rate, because right now we have 103 cases in the United States and 6 died. So that's 5%, 5 to 6% fatality rate. So why Asians have a lower case fatality rate? If you analyze, if you analyze the endocytosis process, the entrance of virus to the cell, trypsin enzymes is involved. Now, Asians are eating more soybeans and also taking ginseng tea. They are known to be protease inhibitor. So if you eat protease inhibitory food, it will inhibit the activity of trypsin. Therefore, it will delay or retard the endocytosis rate. And that's the explanation why the Asians have a lower case fatality rate, because eating a trypsin inhibitory food can delay endocytosis. So here I've gathered the data from PubMed.gov that endocytosis during viral entry is reported to require a low pH in an intracytoplasmic vacuole. So eating alkaline food protects you from the virus by delaying or retarding the rate of endocytosis. Because if you eat alkaline foods and vegetables, usually the pH of the cells are somewhere around 6 to 6.5, are somewhere around or 6 to 7. Now, different parts of the body have different pH, but more likely the pH of the cells are somewhere around 6 to 7 if you are eating alkaline food. But if you're eating acidic food, the pH is somewhere around 4.5 to 5.5, which is favorable for the endocytosis process or the digestion of trypsin. So the symptoms are shortness of breath, cough, fever, runny nose, stuffy nose, sneezing, sore throat, headache, fatigue, chills, and body aches, muscle pains. Prevention is wear N95 mask in areas where there's a lot of infected people. Wash your hands more often and do not touch your hands without washing. Avoid touching your eyes or nose without washing your hands. Avoid close contact with people who are sick. Stay home when you are sick or becoming sick. Cover your cough and sneeze with a tissue. Clean and disinfect frequently all surfaces. Clean and disinfect frequently all surfaces that you are going to touch, like the doorknobs, the table. The risks are recently, if you the risk you recently traveled to China, you are the greater risk. Healthcare workers who are exposed, who are caring for COVID-19, close contacts with COVID-19 patients. And if you have an underlying condition such as cardiovascular disease, you have a higher rate of mortality, which is close to 15%. If you have a diabetes, you have a greater than 7% mortality rate. Kidney disease can also raise the mortality rate. That there is no treatment and there is no drugs for the vaccine. So to protect yourself, wear mask, distance yourself from public gathering, avoid travel to areas with COVID-19, wash your hands frequently, and eat more alkaline food, because eating alkaline food could bring your cells to a pH 6 to 6 point. Eating alkaline food could bring your cells to a pH 6 to 7, where the virus cannot For the virus, endocytosis will slow down at this pH. Eat high protein plant-based diet. This is to reduce the ACE2 receptors activity, and eat also sesame seeds and oyster mushroom. These are ACE inhibitory food. So ACE inhibitory food is known to bind the ACE receptor. So therefore, the virus cannot enter. So there is now a study that the high blood pressure medicine, ACE inhibitory blood pressure medicine, can bind to the F can bind to the ACE receptor, and therefore blocking the receptor site of the virus and reduce your symptoms. Eat more protease inhibitory plant-based. The soybeans, black-eyed peas, and ginseng are known to have a very strong or potent trypsin inhibitor. So therefore, by eating this protease inhibitor food, you can delay or retard endocytosis of the virus. Exercise also to boost up your immune system, and take vitamin D3. So vitamin D3 is very necessary in macrophage by engulfing. This is important in engulfing the virus or fighting any foreign invaders. Vitamin 3 can strengthen you that one. And do not eat high sugar content food, because your second line of defense in immunology, your neutrophil your neutrophil phagocytic function will be diminished if there is a high sugar content. So take mega dose of vitamin C to boost up your immune system, but you have to drink a lot of water to avoid stones formation in your kidney. So thank you very much. My name is Glenn Vale. Thanks for watching, and if you like, subscribe my channel. Once again, thank you.